Uh, Hi, everyone. Welcome. I expect some people to be filtering in, uh, but we'll try to keep this to an hour. We're in a funny time of year because I don't know about the rest of the people in this meeting, but municipal election times are kind of busy times for me. And so I was really happy when Jen reached out in more like a campaign mode um, to introduce us to the Patients Over Profits pledge and the work that National Nurses United is doing right now. So the first thing on our agenda is a piece on the Patients Over Profits pledge. And in addition to Jennifer Peck, Joe Beards, wait, I keep getting it wrong. I keep thinking it's like Beardsley, but it's not. I'm really sorry, but Joe Beardsmore, who is an organizer with National Nurses United on the national front. So where are you calling in from?
Hi there, and you got my name spot on. It's Beardsmore. It's an English
Uh,
name. I'm joining.
okay.
I'm from California. I'm joining from California.
Oh, okay. Thanks so much for joining us. So I think we might just want to go right into it. It can be, pretty informal to let us know what's happening with National Nurses United and this particular campaign, and then we can have some questions. So, be my guest.
That sounds great. Thank you so much, and thanks for having me on this call, and thanks to Jen for organising. I thought maybe a way we could tackle this is I could give a bit of a background about the campaign, and then Jen could speak about the work she's been doing, and then, like you say, hopefully lots of time for questions and to talk about any potential next steps. So yeah, I'll dive in here, and I'm not going to do lots of background on why why fighting for Medicare for all is important. Obviously, you all know that very well. So I'll try and speak more to the specific strategy of this campaign. So this campaign is led by National Nurses United in coalition with dozens of other organizations that work on healthcare justice. But you don't need to be a nurse to be involved in this campaign. So there are volunteers involved from all across the country and all walks of life. Nurses are committed to fighting the oversized influence of the corporate healthcare industry on our political process because they see firsthand the effects of our broken system every day, and also see how politicians are beholden to the industry, and that these politicians are standing in the way of the much needed reforms like Medicare for all. And just to stick on that point for a moment, the industry that spends more money on lobbying than any other in this country is the pharmaceutical industry. And the second highest spender is the insurance industry. And just a few places behind that in that horrible list is the hospital industry. So we believe it's really important to try and drive a wedge between these, the private healthcare industry and elected officials who are supposed to represent the people. So National Nurses United are really, really committed to a legislative path to Medicare for all. We do believe that eventually we need to pass national Medicare for all legislation. And, we need to really fight hard to get that. But we think that we're not going to solve this purely by following a legislative strategy. That's why we think it's important to take on some of these corporate interests head on. And that's particularly true of a moment like now, where Republicans have control in the House, and Medicare for all is not the top issue which is being pushed by this administration. So we're focusing on what we call the Patients Over Profits campaign. We shorten down to POP. So if I refer to it as the POP campaign, I hope you can follow what I'm saying. And what we've been doing with this POP campaign, we came up with a pledge that elected officials could sign, basically rejecting donations from the corporate healthcare industry. And after I finish speaking, I'll share a link in the chat which can show you the exact wordings of that pledge. we've been working with volunteers all across the country to approach politicians and ask them to take that pledge. We haven't just been approaching everyone. We've been going for what we refer to as low-hanging fruit. So politicians that we believe are susceptible to our message. And the reason we're doing that is because we're trying to build some momentum behind this pledge and build credibility before we then go and approach some bigger targets. And our strategy was informed by organizers at the Sunrise Movement, who they enacted a similar pledge around fossil fuel subsidies a couple of election cycles ago. And they worked by first going for the friendly on-side politicians, having them sign the pledge, building up momentum, and then approaching higher profile figures. So that's what we're doing. So we've compiled a list of candidates and politicians that we believe will be receptive to our message, and then we are contacting them. And when I say we, I'd really stress that this is a people-powered campaign. So there are people like myself who are staff organizers who are helping to support this campaign, but really the hard work is being done by people like Jen and people all over the country who are giving up their time to contact politicians. There's two ways in which that happens. So one is through online outreach. So basically sending emails or using social media and phone calls to contact candidates and asking them to take the pledge. And then the second component is actually showing up to events and asking candidates in person if they will sign the pledge. That's a really successful tactic. It's been working really well for us. And we actually have a volunteer team who are finding these events that are taking place. We have 13 states which we're concentrating on right now for in-person events. Volunteers find those events where politicians will be attending. We then recruit other volunteers who are part of this movement to attend and ask people to sign the pledge. I think that's probably enough from me for now. I'd love to speak to you all a bit more. I'm happy to answer any questions and would really love to speak to you all more about how you might be involved. But I'd also love to hand over to Jen to speak a bit about her experience as part of this campaign.
Thank you, Joe, and thanks, Rana, for inviting us here. I appreciate the background. So I am one of the volunteers. I do help the team find in-person events for the state of Massachusetts. Connecticut is not one of their current target states for in-person events. I had approached the team. I said initially, low-hanging fruit was defined, I believe, as DSA electeds and people who had already signed the No Fossil Fuels Money Pledge. I approached the team and I said, I also believe that Green Party candidates are likely signers as well, as they reject corporate campaign donations. And they said, you have our blessing to go ahead and contact anyone. Sometimes it's a question of manpower or like person power, who we're contacting. And so I did reach out to Rana and the state Green Party, and I'm slowly contacting some local Greens to sign the pledge. We have, I think, 2 so far, Mary Sanders and Keith Kimball. I approached 3 people on the Hamden City Town Council who are DSA endorsed. I haven't heard back from them. And I did approach David Michel. I think he's the assistant majority whip. He did sign that as well. And so that's the work that I've done. I'm happy to continue reaching out within Connecticut. I'm also happy to collaborate or coordinate with this group in whatever strategy seems to be a good approach for working together. We have the same goal, I think, and the way it gets done. I'm certainly happy to collaborate. I'll hand it back over to Joe or.
Well, Joe, if you want to talk a little bit about, what the overall strategy is, if you don't have what you want to say already prepared, my question would be, what are your plans for following up with these? Well, now we're in an election season, these candidates, or, once they become elected officials, to move things forward.
That is an excellent question. So at this stage, what we're doing is trying to get as many people to sign on to the pledge as possible, because we're hoping that by building that list of people, it's going to really help us gain momentum for this campaign. In terms of how we then organize the people who who actually sign the pledge once they become elected officials. We haven't, we haven't developed like a plan for that yet. But what I would say, one thing that's really interesting to me about that is the overlap between that and this, the movement to have Medicare for all resolutions passed at multiple levels. Because once we have this list of politicians who have pledged they won't accept money from the corporate healthcare industry, we can assume that they're kind of on our side in terms of the types of, the need for healthcare justice. So I think they would then be receptive. They may well be receptive to resolutions. And similarly, vice versa, in places where resolutions have been successfully passed and championed by elected officials, they could be people who'd be willing to take the pledge. So I can see like real overlap there. But at this stage in the Patients Over Profits campaign, we're really in this this kind of like building phase where we're trying to get as many candidates signed up as possible so that we are in a position where we can then start approaching federal candidates and more high profile politicians and actually putting this to them both as a pledge which politicians who are already on our side can take, but also as a challenge to those politicians who we see as overly beholden to the corporate healthcare industry.
Are there other questions for Joe or Jen? I mean, I can ask forever, but what state, you mentioned that some states were particularly promising. What states seem like they're, best to be working in, and why? What are the characteristics of a state that might be ready for this kind of campaign?
Yeah, good question. So I'd say there's a couple of different things going on here in terms of how we work with different states. So in terms of places where we want people to contact candidates and elected officials, that we're really keen for that to happen everywhere. So as Jen was saying, she has been contacting people in Connecticut. She's been getting people signed up to the pledge. And if there's anyone in this group who's interested in helping with that, I'd love to discuss that more. So when it comes to that, the outreach via email and social media and by calling offices, that's something that's happening everywhere. The thing that's slightly more targeted at this time is where we're helping people to attend in-person events. And really, one reason behind that is just that we're still building out that tactic. So we've been doing this now for a few months, and we've been testing to see how successful it is. So initially, we had to start with a smaller list of states before we can build out. And in terms of choosing those first states, that was based on a few different criteria. One is where we know that we have a high concentration of Medicare for all supporters, because of course we need to have people who are ready to actually attend those events. But there is another component which relates to like a broader strategy of the union, which is where are the states where the union needs to build strength, because we need to be able to, and where do we need like a multi-pronged challenge to the power of the corporate healthcare industry. So we have paid particular attention to some southern states where we know that more effort is needed to build up the movement for healthcare justice. So those are the kind of criteria for where we're helping people to find in-person events. But in terms of reaching out and contacting candidates and elected officials, that is like absolutely something that we're really keen to be doing in Connecticut. And as I said, I'd be really interested in hearing if there are people in this group who are interested in doing that, because there are ways in which I could help to plug you in, either as individuals who just want to join this as a volunteer, or if there's something that this group would be interested in doing together as a group, that could be really interesting as well.
I think you mentioned at the beginning that you could share the pledge itself, and I can make one of you a co-host so you can screen share. Do you have it, Joe? Okay, hold on. I'll give you that status, so you should be able to screen share it and talk about what's in the pledge itself.
Yeah, thank you. Just bear with me one moment while I get this set up. Okay, so you should be able to see my screen now, and the concerning number of tabs I have open on my desktop. But I'm also on the website for the Patients Over Profits campaign, and I'd encourage people to take a look at this. And again, I'll share the link in the chat. But I'm going to just scroll to the actual language of the pledge here. So I hope you can see that on your screen now. So I think the things that I'd point out is that we are interested in, rejecting donations from companies, but also actually from significant individuals within those companies. So we are also talking about rejecting contributions from CEOs, also lobbyists who work on behalf of big pharma, corporate insurers, and private hospitals. Specifically, we have been targeting or looking at organizations associated with the Partnership for America's Healthcare Future, which was a dark money lobbying group which was set up specifically to try to block Medicare for all. That was in 2019, I believe, that happened. But you can see that the language of the pledge is pretty straightforward, and it's a way for candidates and politicians to show that on this issue they are siding with people and what's needed, as opposed to the the private healthcare industry.
Well, I see that Representative David Michel has entered, and I don't know if you can talk to us, Rep. Michel, but what are your thoughts on Connecticut legislators' potential support for the pledge? Because I think of things, I work a lot more on the municipal level, but and not quite as much on the state legislative.
Yes, and I'm driving, so this is a weird image. What? The Capitol is following me?
Sorry about that.
No, it's funny. To pass legislation that we've tried to pass before, I think there is some changes in leadership, because if leadership stays the same, we won't see any progress in Connecticut. I don't know if that makes sense, if what I'm saying is answering your question, but there definitely would be some legislators in the state of Connecticut that would take such pledge, but I just, it's what are we going to achieve here in Connecticut? And all too well, the fight is on. It's not like we didn't start it.
Yeah, and you were one of the fighters, I know, but we all learned maybe a year and a half ago that gatekeeping at the legislative level, state legislative level in Connecticut is extreme. Are there any other questions for Joe or Jen about this pledge? Where and I think you said can you put the if you haven't yet, put the website in the chat so people here can get the information to any municipal candidates in their towns?
Yes, thank you. I just put that in. So that website gives you some background on the campaign, and I'm going to share another one now with a form where people can actually sign up if they would like to, if they'd like to become a volunteer with this campaign. And I do just very quickly want to take the opportunity to thank the representative for showing leadership on this issue. He signed the pledge, and that's brilliant, and I really respect that. And I think any efforts he can make to help us organize other elected officials in Connecticut would be really welcome. He showed leadership on this, and I think like any other help he can do to encourage others to sign the pledge would be really welcome as well.
Yeah, thank you. If any other questions come up, put them in the chat. I think I don't know how the order was on the agenda, but I think it might be a good idea to talk a little bit about municipal resolutions. I was hoping there would be some people here from other towns that passed resolutions. It's really amazing to me how many different organizations there are that are working on this topic, because it's National Nurses United. The municipal resolution campaign is pretty much spearheaded by Public Citizen. We have PNHP working here, and they're fighting the ACO REACH for Medicare and doing some other things as well. And there are some events coming up in Hartford we'll talk about later, but PNHP and CCAG are involved. So it's on a lot of people's radar screens. And I saw that Mary put in something about that New Haven endorsed Medicare for all. And to my knowledge, New London, Wyndham, New Haven, Stamford, and Hamden all supported Medicare for all resolutions between early 2020 and maybe into either late 2021 or into 2022. And Mary, were you involved in the effort in New Haven?
How do we fix that?
Can you guys hear me? I don't know.
Yes, we can.
Oh, okay. Hi. Yeah, I'm new. I'm just getting my feet wet. But I did give testimony back to the Board of Alders. That was part of this. So yeah, I supported that.
Yeah, I'm in New London, and New London happened to be the first town in Connecticut to pass a resolution back in, it was pre-COVID. It was in like February of 2020, January or February. And one of the complications in Connecticut is that we have 169 towns, and each town has different rules for bringing this sort of resolution to the city governing body. So, as I said, I was hoping to have some people here from other towns. New London was pretty easy. We have a paragraph in our charter that says any citizen can bring a potential measure to city council, and city council has to consider and vote, yay or nay on it within 2 months, I think. So we got about 5 people together to sign on to to sponsor this resolution, and got more like 15 or so to testify at various meetings. But it was a very easy process. I know in Stamford, where Representative Michelle lives, I think testified from New London, but it was much more complicated. Their governing body has a lot of people on it, and the process was, at one point, the issue started to be taken up in August of one year, and for some reason got tabled and came up and was passed like a year later. So they did not have that 60-day action window that we had in New London. Wyndham was maybe a little more like New London's. They didn't have the citizen thing, but they had 2 town council members, Dagmar Knoll and Rose Reyes, who were extremely receptive. They could make the motion, they could have a second, and have testimony, and relatively progressive membership on their town council. So it was easy. But New Haven took a lot of legwork. I think there was petitioning to get a lot of residents of New Haven to sign, and it did pass. I think it wasn't controversial once it came, but there was a lot of preparation work. And Hamden also worked on it for about a year before it passed. So, one of the challenges in Connecticut is the first thing a person has to do is figure out what the rules are in your town for initiating that kind of thing. And I want to give a shout out to Food and Water Watch, because they kind of provided the model in Connecticut for municipal resolutions with a fracking waste ban that they got passed in over 50 Connecticut towns. And once over 50 Connecticut towns had passed it, the state passed legislation. It was a critical mass that sent the message to legislators. So I think, and as I said, I'm really sorry that people who worked on resolutions in other towns aren't here tonight. But I think for Connecticut, one of the follow-ups to this Patients Over Profits, campaign for a pledge to, get awareness from our city leaders. The next step, I would think, is in towns that have people who are elected who sign the pledge, is to try to get resolutions passed to pass along to the state legislators and to our members of Congress, both, that our towns and cities really need this Medicare for all. When we were doing budgetary research on the line item, expenditures of New London, health insurance for employees and retirees was the second biggest line item after wages, and it was over $20 million a year in a budget that was about 90 million. So it was a very big chunk of the budget. And so even the conservative, the one fairly conservative council member who questioned all the cost savings, when we gave the numbers to him, he voted for the resolution as well. He probably had never really given a thought to single payer health care. He had worked for the state. He was a retiree. He has really good insurance as a state retiree, which I actually do too, but I still want everyone to have it. But it wasn't his issue at all. And then when he saw, we could either drop the mill rate, significantly, or we can fund other things that we can't afford now with the millions of dollars we could save. I think we figured it was about a 70% saving. It was a pretty strong case. So I guess I will end that part by just saying, if anyone is interested in bringing a campaign like that to your town, I would recommend waiting until after the November elections, because there might be turnover between now and then. Maybe wait till after the first of the year, because in the middle of holidays, it's kind of a tough time, especially if you have newly elected officials. But, at the start of the year, if you are interested in getting in touch with us in Medicare for All, the email is just info@medicareforallct.org, which I'll put in the chat. We would be happy to support these efforts in as many towns as we can. And I'm thinking that some towns that passed the measures over 2 years ago, there's new federal legislation out, and even we could update, the information. Let me just put this in.
Hey, Rana?
Yeah.
I was gonna say also at the end of the year in December and January is when the local town committees are also having their elections for delegates and stuff like that.
Oh,
So
that's true.
it also gets spicy and can change also what happens next year in August in primaries and etc.
Oh, that sounds like a good call as well. And, in New London, I think we're lucky that our state legislators I don't know if they're leaders in the issue, but I think they would go along with the issue. A lot of towns, it's a lot harder. And I am totally not in touch with when the the DTCs around the state are making their plans and figuring out their platforms. So that's helpful.
Yeah, it's when what it's what will decide if there will be primaries, most likely in some towns in the next elections, because the delegates are who endorse, etc. So that's what they do. Anyway,
And you said that starts early in the year, though.
well, it's like December. If there's going to be primaries, which they all hate. They don't want to have primaries. But primaries mean that there might be changes, good changes or maybe bad changes, in DCC and RTCs, that level. So that usually, I think it's December, January, at least in Stamford, it's around that time. I think other municipalities are as well.
So yeah, so really January is a good time to bring publicity to the whole issue. And now is really the time to bring the pledge to your elected officials.
Yes.
And yeah.
Hold them accountable.
Yeah, really. And as I said, I'm more in tune at this time of year with municipal elections, but the state legislators are really important to approach with these pledges now, even though they're not defending their offices this year.
They'll try to defend their delegates in the DCCs and RTCs.
Yeah. I don't know anything about that stuff. I'm blissfully ignorant, I must say.
Happy to have a discussion with you in the future. It might give you some good intel.
I think that would be helpful. We do have the GTC in New London.
Wow.
New London and Wyndham both have GTCs, but they operate differently than the RTCs and the DTCs. We can't do primaries for one thing. But thank you. The next thing on the agenda, and I really want to keep this down to an hour, I was hoping also that we would have an individual or two to talk about the event in Hartford tomorrow. And I don't think either of the two people I thought would be here are here. So I'm going to share the screen to give information about it. I think this is it. So we had patients over profits. This is care over cost. And tomorrow in Hartford at 10 a.m., PNHP, I think, is spearheading it, but CCAG is involved. There are a lot of different healthcare advocacy groups that are in on this, and they are holding a rally meeting outside of the Aetna headquarters on Farmington Avenue in Hartford. Let me scroll up a little. 151 Farmington Avenue, and then walking to the United Healthcare headquarters, which is not very far away, because Connecticut is the insurance capital of the world, and every year we hear about the requests and some of the successful requests for increases, and it's really incredible that insurance is so expensive now, and every year we're hearing the insurance companies want a bigger bite. So yes, it's PNHP, Connecticut Citizens Action Group, Be a Hero, People's Action, and the New York City Organization of Public Service Retirees. And I'll actually put the RSVP in the chat so that if anyone here either wants to go tomorrow or wants to let your own network know about it, I will be able to get the word out. So let's see if I'm just going to do this and then stop sharing and put it in the chat. Okay, I'm hoping that that will get people to the RSVP. And really, I know it's early, but we don't have that many people here. Did anyone have anything to add about the rallies tomorrow in Hartford? I think in that case, I would like to ask if anyone has announcements of other events or other issues that we should be in tune with. There are a few people here who, know what's going on. And, if there's anything that this group should know about, I'd love to have that information shared. This, by the way, will be probably posted tomorrow on our Medicare for All Connecticut YouTube channel. So we'll give the link out so more people will get the chance to see it. Okay, I guess in that case, I will just end with kind of a standard plea. Doing work for Medicare for All Connecticut is it's basically no pay, great cause, and if anyone would like to get more involved, we could use help organizing, we could use help with communications, with graphics, with helping people in towns who want to organize and do resolutions. And once again, the email info@medicareforallct.org would get in touch with the current people in the executive committee. And if you want to work on, whether you want to work on policy, on fundraising, on legislation, on the possibility of forming a 501c3 in order to fund our own study, which is something that is on our planning because the state legislature doesn't seem to want to fund a study to find out how well our state would be served by this sort of change in how people's healthcare is delivered. Let us know because we could use the help. And I guess with that, I will thank Joe and Jen very much for joining us today. And we'll get this out on YouTube so that more people can see it. So thanks very much.